Hi, I'm Dr. DeCubelis, and let me share with you the most effective therapies to relieve auto-related injuries such as neck and back pain. First, we need to talk about the phases of care and phases of treatment. The first is going to be the inflammation phase. Now, during the inflammation phase, the goal is to not only decrease pain, but decrease inflammation in the tissues as well. Therapies that we would want to use during this phase include ice, which is going to help decrease swelling. We also would like to use electrical muscle stim, which is going to help reduce muscle spasms, increase healing, and allow you to get the mobility back as quickly as possible. Now, in the second phase, this is called the repair phase. Now, in the repair phase, our main goal is to get normal motion back, and there's three phases of motion. We have active, we have passive, and we have joint motion. It's important to get all three phases of motion back, or we will not be able to get you back to not being in pain and getting back to your normal lifestyle. Now, the types of therapies we would want to do during this phase include physical medicine, such as chiropractic, and massage therapy. Now, these are very important because when we talk about massage therapy, this is going to help decrease muscle spasms, increase tissue healing, and promote normal range of motion. With the chiropractic adjustments, we're not only going to be able to get that tissue moving properly, but we're going to be able to get that joint motion back that you can only get through chiropractic adjustments. This is very, very important because if we do not get this back, we set you up for increased pain, permanent disability, and problems later in life. So we must get back this joint motion. Now, the third phase of healing is the remodel phase. Now, the goal of this phase is to not only increase strength in the damaged tissue, but to increase mobility and range of motion as well. Now, the treatments that are very, very crucial to this phase include active and passive exercise and neurological stretching. The reason we need to do this is because we need to make sure that we get this tensile strength of the tissue back, but also get your range of motion and movement patterns correct. Otherwise, we risk not only permanent impairment, but the possibility of you re-injuring these tissues in the future, and that injury will be much worse than the injury you have now. The goal of these phases is to not only decrease pain as quickly as possible, decrease muscle spasms as quickly as possible, and get normal movement back, but to make sure you don't suffer permanent impairment from your injury. So if you're suffering from automotive injuries such as neck pain or low back pain, please give me a call at 630-435-6461, as I'd love to help you out.